Hello and welcome to Health Connections, the television program that connects you with a healthy way of living. I'm your host, Hunter Reno. On this inaugural episode, we'll talk about the importance of health literacy and what it means to you. Also, we'll explore the ways to a healthy mouth with preventive dentistry. But first, Health Connections is a new television program created by a very innovative team at the medical campus. Their main goal is to inform our residents on how to live a healthier and better life by practicing prevention. To explain further on the purpose of this new and exciting show, I'm joined by Dr. Mark Everett, President of the Medical Campus. Welcome.
Thank you very much, Ms. Reno.
So tell me, what is the purpose of MDC Talk Health Connections?
Well, it's very far-reaching. We have so many ideas, so many innovative ideas from an innovative team, as you suggested. We have a team of faculty, of staff, of area specialists, various partners across Miami-Dade and Broward, to include Jackson Health System, Larkin Hospital, Baptist Health System as well. So we're very excited about this opportunity. But the purpose really is what the name implies. It's about connections. It's about connecting people to more information about their health care, more information about services available in the community, more information about how they can improve their own health by simple steps.
So what contributions to the community will MDC-TV Health Connections make?
Well, let me start by indicating that first and foremost, I've been affiliated with Miami-Dade College now for nearly 6 years. And in that 6-year process, I've been involved with our health fair at the medical campus for those 6 years. And what we've found across the health fair activities is that individuals are just looking for information. We found that 50% of those attendees did not have a primary care provider. They need to get connected to primary care services. They need to know what resources are available in their community and what simple steps they can take to improve their health and also health literacy. So taking that information, we knew we needed to do more for our community. As Democracy's College, Miami-Dade College is always at the forefront of doing more for our community and giving back to our community. So Miami-Dade College Medical Campus, as the medical campus in the area, we have over 23 programs with specialists in their own right. All of our faculty across our nursing program, respiratory care, physician assistant studies, physical therapy assisting, you name it, we have a medical program, and associated faculty that are experts in their own field. So while we instruct and we teach our own students, I think there's a lot of information that our public could benefit from. So we're going to take some of those components. We want to share some of the real simple steps, basic steps, but also take it a step further to prevention and services and what's available in the community. As we do the health fair, as I mentioned before, individuals do not know what's available in their own backyard. So whether it's free services, whether it's discounted services, whether it's services provided by specialists, they're lacking that information. So we want to connect them to a primary care home. We want to connect them to their resources that are available in their community. So we're very excited about this new show and what it has to benefit.
It sounds exciting. What are the most urgent issues that you're seeing MDC-TV Health Connections should address?
I think health literacy is by far the most important. We have to improve the health literacy of our community. There's so much information out there, whether it's via internet, whether it's social media, you name it, and some of it's misinformation. So we want to take advantage of this wonderful opportunity through MDC-TV and provide pertinent information that individuals can use, whether they're students, whether they're adults, whether they do have a primary care home but need a little more information about their ailments or chronic diseases. We want to provide that information and be a resource for them.
Now, you had mentioned earlier about your partners, so how will they be assisting in this process?
We have fantastic partners. So we have put together a team about 4 or 5 months ago to really start talking about our Health Connections show. And we had several entities Surface that provided a lot of input to the planning of this particular show. So as I mentioned, Baptist Health, Larkin Hospital, Jackson Health System, and the Public Health Trust will be partners along the way. So these individuals will be very important to our episodes because they will provide many specialists that can come and talk about diabetes or heart disease or other chronic diseases. So we're looking forward to partnering with them in the future. They have been instrumental through the years as we partake in our health fairs and community events. Last year we did over 40 health fairs, and many of the partners participated with us. So instrumental, to say the least.
So we talked about the purpose, we talked about the contributions, and also the issues, the urgent issues, in addition to the partnerships. Is there anything else that you feel would be important to share?
Well, I think it's very important that the individuals watching the show really pay close attention because the information that's going to be put forth is going to be very critical to their own health care. And I think it's important for individuals to start taking ownership in their health care and really truly take it serious, because little things that we can do, whether it's diet, whether it's exercise, can prevent the onset of various diseases. So in my previous life, I had a lot of experience with diabetes care, and I know that diet and exercise really can help delay the onset or actually prevent diabetes. So it's very important that these little steps are taken very seriously. I think we can truly make a difference in the health of our community, the health literacy of our community, and truly, truly make a difference.
Wonderful. We're going to take our first break, and when we come back, we'll discuss the importance of health literacy. Stay tuned.
Be focused. Be original. Be a trendsetter. Be an explorer. Be the solution. Be visionary. Be a hero. Be the answer. Be the best. Be you. Be MDC.
Fresh thinking is being served at Miami-Dade College. Create your own recipe for success in the evolution of food culture at the Miami Culinary Institute. Learn the skills you need to jumpstart your career in the culinary arts. Turn green into gourmet and celery into salary. Miami Culinary Institute. Food, culture, innovation. Visit us at miamidadeculinary.com. Register now. Miami Culinary Institute.
Welcome back. In 1999, Mrs. Helen Osborne founded Health Literacy Month in an effort to raise awareness about why health literacy matters. In the studio, I have Ann Graziotti and Dr. Guillermo Valdez, both professors in the nursing program. They will discuss the importance of finding the right words for better health. Welcome. Thank you.
Thank you.
So, what is the meaning of health literacy?
Well, health literacy is really the process of obtaining information so that you're able to really navigate well in healthcare, specifically addressing all the barriers that are often there because of patients' and families' lack of understanding. Whether you are at a clinic receiving care from a physician that's going to address some important issues in prevention of health, or whether you access our more acute care system like a hospital, in where there are so many legal, regulatory concerns that also impedes the communication among healthcare providers and patients. So the process is to really understand what are your rights, the kinds of questions that you need to ask your healthcare provider so that you're able to understand and become a little bit more aware of how you can consume that healthcare delivery system, also help your primary care provider, whether it's either in a clinic or in a hospital, give you that kind of care based obviously first on your needs, which one of the problems with the barriers is that the care becomes what I would say objective, that is on the views of the healthcare provider, but not so clearly on the views of the needs of the patient. So health literacy really helps to overcome. It's a process that helps to overcome that perspective, both through education and understanding in simple ways that patients are able to really understand what's really happening to them.
And what is the meaning of health promotion?
Well, health promotion is really giving people the tools that they need in order to lead a healthy lifestyle. So as Dr. Valdez pointed out, we know what we need to do, but we need to do a better job of educating our patients. So we were charged back in the early 2000s by the Institute of Medicine to do a better job with our patients, to assess where they are, what they need, and how we can empower them to really lead healthy lifestyles. So the National Patient Safety Foundation has given us tools to use with our patients, with our families, to be able to ask questions, to be able to voice their concerns, to be able to speak up to healthcare providers, because we really need to do a better job in helping people improve their health.
Will MDC-TV Health Connections engage the community in promoting a healthy lifestyle?
Absolutely, that's the purpose of our program here. Two basic concepts: communication. That's first of all. That is the number one problem we have in healthcare, is the problem with communication between healthcare providers, between patients, the environment that they're caring for. So two things we want to do. We want to raise awareness about healthy behaviors and processes that are there so that you're able to clearly understand what is going on in a very difficult and paradoxical, confusing healthcare system. And the other one is to educate our community in simple ways, specifically with the understanding that they have rights, and that these rights are really embedded in, you have a right to ask your physician why this is happening. You have a right to ask the nurse what type of medication this is, what does it do for you, not just at discharge within either a clinic setting or at a hospital, but from the beginning process as you're planning your care. Remember, we've got to go away from the thought of just health care, but also address health planning, so that whether you're in a terrible situation, obviously an emergent, most dire situation, or you're just accessing prevention, you are always one step ahead in planning how to have a better outcome for your personal life quality.
Mm-hmm. And will MDC-TV Health Connection engage the community in preventing disease within its residents?
Well, we know that our number one issue in Miami-Dade County is access. So in order to help contribute to helping people with their access, yes, we know the resources that are available. We educate our students through the programs on how we can tell people where to go for what they need. If it's an insurance issue, if it's a pharmacy issue, if it's a primary care issue. So we're working very hard with our students at Miami-Dade College to make them health promoters for patients also.
I have a question.
Yeah.
So in my rotation this past year, I noticed a tremendous amount of pain and fear with patients. Not only were they exhausted, not sure what their outcomes were going to be, but trying to have the confidence to engage in language with their providers, with their doctors. I found it to be a very intimidating environment. So what do you think about that?
One of the things that we're doing to address that issue is not only addressing the experiences of patients, and that is very important, but also healthcare providers understanding the experiences of patients. It goes both ways. So we have a lot of initiatives with media campaigns. We have a lot of the community projects that we do. It's not only there to educate the community, but also to serve as a lived experiences for those that are going to go out in practice, so that they see what is really happening to these individuals before they even access healthcare, before some of them emergently do it. As you know, we have different types of access, and people an ability to receive health care. So therefore, that becomes pivotal to them. I think it's really important to understand the patient experience, the human experience, and the vulnerability, which are really important concepts. Population-specific healthcare, understanding the cultural dynamics of patients, spirituality, religion, age-specific care, language, which is really important, choices they have, economic access, limitations, so that healthcare providers also serve as promoters of this well-being for patients and really bridge the gaps in knowledge, both from the knowing and the actual doing, which continues to be a problem. I think this will definitely help to serve that purpose of clarifying the processes, both for access and for those that are providing care to those that are receiving the care.
I really look forward to seeing this program and seeing more about that. We are taking another break, but when we come back, we'll discuss the importance on maintaining a healthy mouth by protecting those pearly whites. We'll be right back.
Be focused. Be original. Be a trendsetter. Be an explorer. Be the solution. Be visionary. Be a hero. Be the answer. Be the best. Be you. Be MDC.
Education and opportunity within reach. You're watching MDC-TV.
Welcome back. The Spanish writer Miguel de Cervantes once said, "Every tooth in a man's head is more valuable than a diamond." And it is proven that a healthy mouth means a healthy body as well, making that quote worth paying attention to. According to the American Dental Association, researchers have found that periodontitis is linked with other health problems, such as cardiovascular disease, stroke, and bacterial pneumonia. To explain further on the importance of dentistry and how it helps our body, I'm joined by Dr. Eliana Pino and Dr. Alwyn Leba, both professors in the Dental Hygiene Program. Welcome.
Welcome.
So why is preventive dentistry important?
Well, Hunter, people think that oral health is separate from general health, and thus probably think it's not very important. And there's many reasons why preventive dentistry today is important. The main reason, though, is that the major diseases, infectious diseases that affect the mouth can be prevented. Take example, dental caries. About 92% of the American population has had a cavity. Mm-hmm. The main chronic disease of children is early childhood caries. About 4 million children have this disease. Again, it's a disease that's preventable. And in the most recent study that has been done, in a national study, we noticed that children over 5, the dental caries have gone down, but the children that are 2 to 5, it has increased. Which is a real shame because this is a preventable disease. And we know that children, by the time they get to kindergarten, 40% already have a caries. Now, another disease that can also be prevented, one that you mentioned, is periodontal disease or gum disease. This disease, many people have. I would say there's many forms of periodontal disease, from gingivitis to the more destructive kind, but most adults have this disease. Again, it can be prevented. And if it's not prevented, it could cause people to lose their teeth. And we know that when people lose their teeth, especially the elderly, sometimes they change the foods they eat. They start selecting other foods that might not make them very healthy in the long run because they need to eat a variety of foods. So we really need to be informed of these diseases and what we can do to prevent them, so people can keep their teeth a lifetime. You know, a lot of people think that as they get older, they're going to lose their teeth, but this is a myth. We are to keep our teeth our whole lives.
Why is it important to have a healthy mouth?
Well, it's important to have a healthy mouth for several reasons. And a couple of those reasons are: one, to prevent bad breath. Second is to prevent tooth decay, and third and most importantly is to prevent gum disease. According to the Office of the Surgeon General, about 75% of the U.S. population have some form of gum disease, meaning from the least portion, which is called gingivitis, which is just the inflammation of the gum, or the advanced stage, which is periodontitis or periodontal disease, which is inflammation of the bones and the gums. So as you can see, it's very important to maintain a good health. According to the Academy of General Dentistry, there is a link between gum disease and heart disease, as you stated before, and Dr. Pino stated, and also stroke. So as you can see, and also there's other studies that have showed about 90% of anything that's going to happen to you systemically starts in the oral cavity, meaning diabetes, oral cancer, heart disease and stroke, as we stated before, in women, low birth weight, babies, and of course digestive health. And digestive health is because of missing teeth. Like Dr. Pino stated before, is that we have this assumption as we get older to have missing teeth. That's not the case. We need to keep everything that we have to ultimately not only have an oral health that it's healthy, but also a healthy system in the body also.
What are some simple things that people can do to keep their mouths healthy?
Well, getting back to children, because this is a passion of mine, people don't sometimes realize that children are born with all their teeth. They're just underneath the gums. So more or less they come in, they start erupting about the time they're 6 months old, but before that the teeth start erupting, parents should wipe the gums with a soft washcloth. Then once the teeth erupt, using a soft toothbrush and just plain water, just brush the teeth every time the baby feeds. Now as they get older, 3 to 5, then they could put a little pea-sized amount of fluoridated toothpaste on the toothbrush, and again, brush the teeth after every time the baby feeds. Now, another thing that parents can do is not to share their eating utensils or kiss children in the mouth. These are behaviors that, unfortunately, it can transmit the bacteria that causes cavities to the child. And the other thing is, what we find is that some parents are putting sugar in their baby's bottle. And they maybe put sugar in the milk, or they give babies sugary type of liquids. That should not be done. And also controlling the snacks that children eat. They shouldn't be eating sugary snacks. And if they're going to eat something that has sugar, it should be with the meal, but not in between meals. And that will also help to prevent cavities.
Right. And so make sure you're brushing at least twice a day for at least 2 minutes. Also flossing, making sure that you are getting those areas that the toothbrush cannot get. And most importantly, have a healthy diet. Make sure you're eating something that is high in vitamin C's, vitamin A's, and so on and so forth to maintain that oral health pretty well. And of course, most importantly, is to visit your dental professional, your dentist and your dental hygienist, and also come and visit us at MDC Medical Campus Dental Hygiene Clinic. We are there to support the community. It's totally free for children, and for adults, $20. All the preventative care that's needed, we will support that.
Thank you so much. As they say in the dental industry, a dentist gets to the root of the problem, and we certainly did. We hope you enjoyed and learned from this television program produced by the Medical Campus to inform our community on health prevention. Remember that prevention is the name of the game. I'm Hunter Reno. Thank you for watching, and have a healthy day.